kilong ni kilong kapa, kikmina kikmisan, kikap kiman, kimen kipara, kinhei batsendrang, baro tu syaskor, gandon kehelka, hakaba on sepelong, ya kacing screen, na kabenta, kacing pang TV, batlada idon kam, panleru, ya ka Xray, klem don kam, mansiu bisa. Gibril kiba khamdon ha kajing ma bandon ya kajing pang tibi ilong kini gibala yo ya kajing pang tibi ha ka sansnem baladep gitu kiba saalang ne kiba kindu bat kinong pang tibi gitu kibala kinjo ya ka ribo snem seneng gitu kiba duna kajing kia kependi duma menta ban mensua kiba don ya kajing pang diabetes Ladadan kipara marjan marpa jempi ibadan ya gidak kisien jong kajing pang tibi kum kabajerho mikir kha pang syadem hiar jingkia jerho snam shitman tsf hakapor menmit wan ban pates no menta kasi pilaru banyo ya kajing sumar na kabenta kajing pang tibi na gijika sumar bahajan jempi mau benom kuslai sepang kecing pang TV wan pates loy lada lap pidon TV sedang di dawai marmar haba pidi dawai tista hadu bekut kepor sumar pin seyok yang ya kecing kot jengkia bepura kublai sibun.
Before we start, I think I would like to inform you something about tuberculosis. As all of us know, tuberculosis we commonly extrapulmonary. Pulmonary is the disease which is contagious and it's infectious and it spreads to other people. But extrapulmonary, which is outside the lungs, like you can have TB meningitis, tuberculous spine, abdominal coughs, or lymphadenitis where the lymph node swells, bone TB. These extrapulmonary tuberculosis doesn't spread. Why? Because the bacteria is contained inside that organ or in that particular site. So when the vulnerable population who can get this disease is mostly those people who are above 60 years, people who are suffering from NCD, that is non-communicable disease like diabetes, hypertension, kidney diseases, liver diseases, cancer patient who are people who are taking immunotherapy, okay, and same brush also it doesn't spread, okay. So it is the only precaution we have to take is a patient who is having the disease should wear a mask, and the house should be highly ventilated, cross ventilation should be there, and everywhere. And these are the precautions we should take. So once the patient comes, the sign and symptoms of tuberculosis, there are 10 signs and symptoms we are saying now. Before we used to screen people with 4 signs and symptoms. Now we are screening with 10 signs and symptoms. That is cough for 2 weeks or more, fever for 2 weeks or more. Then if they have sweating at night, if fever is increasing in the night time, then chest pain, loss of weight, loss of appetite, and if a person is coughing with blood and there's a swelling in the neck, pain in the abdomen, or these are all the signs and symptoms of pulmonary and extrapulmonary tuberculosis. So once a person is diagnosed, once a person is having a sign and symptoms, when they come to the hospital or they go to the doctor, government, it is from us, the people, from the community. So I request again to all of you also, because this Pradhanamantri Vimukh Bharat Abhiyan scheme is from the people. So what we do is we adopt TB patients. Side of the program which I want to highlight, and then in this 100 TB campaign, what we are doing is we want to detect those missed cases, those hidden cases which are which are there in the community. So we are going to each and every village. We are trying to give the TB-free workplace. So that's why we are here in your office also, so that we can have a TB-free workplace, and we can detect early. We can give early treatment. Why? Because TB is the curable disease. TB is a curable disease if we take care at the correct time. Once the patient keep neglecting the treatment or defaulting, means lost to follow up. Once he has started the treatment and once he felt okay, he stopped taking the treatment, then he become he may develop into resistant and find it difficult to treat a patient, because we had many patients who are lost to follow up, and when they come back to us, they come in a very serious stage where we can't do anything. So that's why we are doing this 100 days TB campaign.
So I would request HOD to say a few brief words before we take vote. Please, sir. HOD, sir, please.
Good morning to everybody. Today's guest, Dr. Madam from government hospitals and all my officers and staffs. As you know that this 100 days TB elimination program is under the Ministry of Health and Family Welfare. The main objective is to eliminate the TB from India and India. Thank you to all.
Thank you, sir. So I would like to request you.
यह रोग समाप्त करने के शपथ लेते हैं। टीबी से स्वयं को, अपने परिवार को, अपने सहकर्मी को और पड़ोसी को बचाने की शपथ लेते हैं। लोगों को खांसने के सही तरीके का पालन करने के लिए प्रेरित करने की शपथ लेते हैं। अपने गांव, अपने जिले, अपने राज्यों और अपने देश को टीबी मुक्त बनाने के शपथ लेते हैं।
Pledge to stop tuberculosis is in my lifetime. Pledge to protect myself, my family, my co-worker, and my neighbor from TB. Pledge to inspire people to follow cough etiquette. Pledge to make my village, my district, my state, and my country TB free.
Kilong kapa, kikmina kikmisan, kikap kiman, kimen kipara, kinhei bachendra. Baro tu syasko, gandon ke healthcare, hakaba on sapelong, ya kajing screen, na kabenta, kajing pang TV, batlada idon kam, panleru, ya ka Xray, lemdon kam, pansiu bisa. Kipriu kibaham don, hakajing ma. Bendon ya kajing pang tibi ilong kini kibalayo ya kajing pang tibi hakasan snem baladep gitu kibasa alang ne kibai kindu bat kinong pang tibi gitu kibalakin jo ya ka triple snem seneng gitu kibaduna kajing kia kebedi duma menta bat mensua kibadon ya kajing pang diabetes ladadon kipara marjan marpa Ibadan ya kidak isyen jong kajing pang tibi kum kabajerho mikir ka pang syadem hiar jingkia jerho sna shitman TSF hakapor men min wan ban pates no menta kasi pilaru banyo ya kajing semar na kabenta kajing pang tibi na kijika semar bahajan ajengki Tukin mau benom kuslai sepang kecing pang TV wan pates loy lada lapidan TV sedang di dawai marmar haba di dawai tista hadu kut kapor sumar pin sa yo biang ya ka jingkot jingkia bapura kubleng subun